Hey, what's up? In this channel we have been dealing with many aspects that have to do with the care of our elderly relatives. After talking about frequent illnesses, such as diabetes, heart failure or Alzheimer's, among others, or dealing with more pedestrian issues such as the care of a bedridden person or diaper changes, the time has come to talk about a subject that is almost taboo, that of the end of life. More specifically, we will focus on the end-of-life decisions of someone who cannot make them. It can be overwhelming to make life decisions for someone who can't, even if the person has put his or her preferences on record. Perhaps we are dealing with someone extraordinary who has drafted his vital wills in advance, but the situation does not exactly fit the circumstances envisaged. Faced with his situation, there are two strategies. One is to put oneself in the person's place and try to decide as she would do, that is, using the substitutive judgment. The other is the one of greatest benefit, and consists of choosing what will be best for the person. In real life, the two strategies are sometimes combined. Regardless of which one we use, it is good to remember if we have ever talked to the person about what they would want at the end of their life, or if they have given their opinion about how someone was being treated in a comparable situation. In short, try to guide our decisions based on the values of the person. In situations where we must decide without clear instructions, it is best to gather as much information as we can. Thus we will base our choices on the best information available. Of course, the doctor is the best person to provide us with a complete and detailed photograph. Here are some questions we can ask him/her. What can we expect to happen in the next few hours, days or weeks with the current treatment? Why do you suggest a new medical test? Can the test change the current plan? Will a new treatment help my family member get better? How will the new treatment affect quality of life? Will it give you more quality time with family and friends? How long does the new treatment take to take effect? If we decide to try this treatment, can we stop it at any time, for any reason? What adverse effects can we expect? And if it doesn't work, what will happen? If we don't try this treatment, what will happen? Is the improvement we've seen a good sign, or is it fleeting? These are difficult questions, and we can feel under a lot of pressure. It would be good to ask them to the doctor by being accompanied by someone else, so that we do not miss anything important. If they tell us something that is not clear to us, it is of the utmost importance to keep asking, and to ask them to explain it to us in another way. We need a thorough understanding of what is going on to make good decisions, and maintain communication if new questions arise, or if the person who is dying needs something. Sometimes the whole family wants to be involved in every decision, either because of cultural tradition, or because the person who is dying has not been chosen to act on their behalf. In any case, it makes a lot of sense to choose a person to liaise with the doctor. The health staff will appreciate not having to inform each family member separately, and decisions will be speeded up while misunderstandings are minimized. And if it is not possible to reach an agreement to choose the spokesperson, it is necessary to know that there is a mediator, who is someone capable of reconciling different opinions and facilitating a common decision. If the end is near, it is advisable to agree with the doctor and his team on the strategy to be followed. Even so, complications can arise that make us rethink the decisions taken. In the next video we will discuss some more in-depth questions to clarify what it means to do everything possible, or what it means to require mechanical ventilation, among others. Thank you very much and see you in the next video.